Anxiety. At its core, anxiety is a natural human response to stress or perceived threat. It's that feeling of unease, worry, or fear that we've all encountered at some point in our lives. Think about an upcoming presentation, a first date, or a job interview. These situations often trigger a surge of anxiety. However, when anxiety becomes excessive, persistent, and begins to interfere with our daily lives, it crosses the boundary into the realm of anxiety disorders. Anxiety disorders represent a group of mental health conditions characterized by chronic and debilitating anxiety that disrupts normal functioning. With increased awareness, understanding, and appropriate support, individuals with anxiety disorders can learn to manage their symptoms and lead fulfilling lives. Anxiety disorders are not a one-size-fits-all condition. They manifest in various forms, each with its unique set of symptoms and triggers. Generalized anxiety disorder, or GAD, is characterized by persistent and excessive worry about a wide range of everyday events and activities. Panic disorder. Imagine being suddenly gripped by an overwhelming surge of terror that seems to come out of nowhere. Social anxiety disorder, or SAD. For individuals with SAD, social situations evoke intense fear and anxiety. These are just a few examples of the diverse spectrum of anxiety disorders. Other types include specific phobias, obsessive-compulsive disorder, and post-traumatic stress disorder. Recognizing the specific type of anxiety disorder is paramount for tailoring treatment plans and empowering individuals on their journey to recovery. Anxiety disorders are not a niche concern. They represent a significant global health challenge, impacting millions of lives worldwide. According to the World Health Organization, an estimated 264 million people globally suffer from an anxiety disorder. In the United States, anxiety disorders are equally prevalent. The Anxiety and Depression Association of America reports that nearly 40 million adults in the U.S. experience an anxiety disorder each year. These figures highlight the widespread nature of anxiety disorders, emphasizing the need for increased awareness, understanding, and accessible mental health resources. Untreated anxiety disorders can lead to decreased productivity in the workplace, strained relationships, and a reduced quality of life. Moreover, they often co-occur with other mental health conditions, such as depression and substance abuse. By breaking down stigma, increasing access to mental health services, and promoting early intervention strategies, we can collectively create a world where individuals struggling with anxiety feel empowered to seek help and live fulfilling lives. Anxiety disorders can manifest in a myriad of ways, affecting both the mind and body. On the emotional and psychological front, anxiety often manifests as excessive worry, fear, and apprehension. Individuals may experience racing thoughts, difficulty concentrating, feelings of impending doom, irritability, restlessness, and difficulty relaxing. Physically, anxiety can trigger a cascade of uncomfortable sensations. Rapid heartbeat, palpitations, shortness of breath, chest pain, sweating, trembling, dizziness, nausea, and muscle tension are common physical manifestations of anxiety. These sensations can be so intense that individuals may mistake them for a heart attack or other medical emergencies. Behavioral symptoms are also prevalent in anxiety disorders. Avoidance, a common coping mechanism, involves steering clear of situations or triggers that provoke anxiety. Section 5. Anxiety's impact ripples across everyday life. The pervasive nature of anxiety disorders can cast a long shadow over various aspects of a person's life. Relationships often bear the brunt of anxiety's impact. Communication difficulties, irritability, and emotional withdrawal can strain even the strongest bonds. Work and productivity can also suffer significantly. Difficulty concentrating, fatigue, and avoidance behaviors can make it challenging to meet deadlines, attend meetings, or perform effectively in the workplace. Recognizing the intricate ways in which anxiety disorders permeate various facets of life is essential for providing holistic support. Section 6. Navigating the path to healing, treatment, and therapies. While the journey of living with an anxiety disorder can be challenging, it's important to remember that you are not alone, and effective treatments are available. Treatment approaches typically involve a combination of therapies, medications, and lifestyle changes tailored to the individual's specific needs. Psychotherapy, particularly cognitive behavioral therapy or CBT, has emerged as a highly effective treatment for anxiety disorders. CBT focuses on identifying, challenging, and changing negative thought patterns and behaviors that contribute to anxiety. Medications, such as antidepressants and anti-anxiety medications, can also play a role in managing anxiety symptoms. The choice of treatment approach depends on various factors, including the type and severity of the anxiety disorder. A qualified mental health professional can conduct a comprehensive assessment and recommend the most appropriate course of treatment. Section 7. Empowering yourself. Lifestyle changes and support systems. While professional help is essential, empowering yourself through lifestyle changes and building a strong support system can significantly contribute to managing anxiety and improving your overall well-being. Engaging in regular physical activity is not just beneficial for your physical health, but also a potent anxiety buster. Prioritizing sleep is crucial for managing anxiety. When you're sleep deprived, your body produces more stress hormones, exacerbating anxiety symptoms. Diet plays a significant role in mental health. Limit your intake of caffeine and alcohol, as they can worsen anxiety symptoms. Connecting with others and building a strong support system can provide a sense of belonging and alleviate feelings of isolation. Section 8. A beacon of hope. Living a fulfilling life with anxiety. Living with an anxiety disorder can be challenging, but it's essential to remember that you are not defined by your diagnosis, and a fulfilling life is within reach. While anxiety may always be a part of your journey, with the right tools and support, you can learn to manage your symptoms and live a life rich in meaning and purpose. Recovery is not a linear path. It's a process filled with ups and downs. Be kind to yourself, celebrate your progress, and don't be afraid to ask for help when you need it. Surround yourself with a supportive network of loved ones, mental health professionals, and others who understand the challenges of living with anxiety. With each step you take towards healing and self-discovery, you pave the way for a brighter future, one where anxiety no longer holds you back from living a life filled with joy, connection, and purpose. Please like, share, and subscribe to our channel for more insightful content.